Hi, I'm Sophia Elliott. As a parent of 3 gifted kids, I'm here to talk about all things gifted because I've been isolated and uncertain, and I felt like that parent. Then I found peace of mind, support, and my community. This podcast is about sharing that journey, actually parenting gifted kids, and connecting with advice and support. So we have everything we need for every member of our family to thrive. This is the Our Gifted Kid podcast. Hello and welcome to the podcast. I'm excited to be here today with Dr. Heidi Lack. Heidi is a seasoned licensed psychologist, health service provider, Harvard trained with a specialization in the field of behavioural medicine at the postgraduate level with over 3 decades of clinical experience. She's also a board certified registered art therapist, artist, soul collage facilitator, published spiritual educator, trained in and personally familiar with misophonia, sensory sensitivities and intensities, overexcitabilities, giftedness, 2E, multipotentiality, ADHD, women in ADHD. The list goes on. An awesome woman. And I feel like there is so much more. Heidi, welcome. It's an absolute pleasure to have you today.
Thank you so much, Sophia, for having me.
And I feel like that was like the 2-second snapshot, because having a look at your website, there is so much more to you and to your practice and what you do. So it's an absolute delight to have you on the podcast today. Tell us a little bit about you and how you first started working in this area.
I love this question. I love how you phrased it. I've had multiple first encounters in the gifted world through education, parenting, communities, and organizations that I'm part of via my professional work as a psychologist. So I continue to deepen my roots in the whole gifted world. I might even say that, depending on how you conceptualize giftedness, that I was born into this realm. As the stories have it, I was a sensory sensitive baby. You could place me on a blanket in the middle of the yard where there was grass, and my parents could walk away and leave me there and trust that I wouldn't venture out anywhere, because I couldn't tolerate the feeling of grass, or I couldn't stand big eyes behind glasses. I had food sensitivities and eczema and sound sensitivities. I was creative and highly empathic towards other people as well as animals. There was ways that I was different than peers in unexplainable ways that nobody had any language for. And perhaps one of the ways to make sense of that is to conceptualize that my favorite animal was a head turner where I grew up in Canada, the platypus. Nobody knew what that was, but I really resonated with this combination that was like this strange mix of uniqueness. And I thought it was so cute and I fell in love with it. But then as I got older, I really appreciated it for all the idiosyncratic ways that it functions and that it meets the world. I wanted to call my business something with the word platypus, but it just didn't work. Growing up, those were idiosyncrasies or sensitivities. People didn't know that could be, or those elements could be described as the gifted profile. I actually saw myself as an average student in high school, even though it was a 4-language high school, elementary and high. I had some creative spikes, but I was a slow reader. And so I was actually shocked to get in the high 90s on governmental exams, but it never hit home that there was like a gifted framework for this, because we all know in the gifted world that disabilities can mask gifts and gifts can mask disabilities. So in college, back in the dark ages of the 1980s, I was an honors psychology major and I signed up for what I thought was going to be like a filler class. It was education of the gifted. It was actually the Renzulli approach, the revolving door model. And in that model, they highlighted task commitment, above average ability, and creativity. And what stuck with me was the creativity. So I had sort of a little intellectual appreciation of giftedness, but it didn't resonate personally at all. Despite academic successes and awards and things like that, the concept of giftedness never entered my mind. Nobody talked about choice exceptionality or 2E in those days, or even gifted wiring in neurophysiology. But many years later, once I was already a psychologist, my son was born. As is typical with many of us, that opens up our eyes to the differences and exceptionalities that really can kick in. And so I got to see the developmental variability in the kids that my son was playing with. Like we'd do play groups and things like that. And he was so precocious in so many areas, verbally, physically. He was running circles around his peers at age 1. And he was so creative. It was kind of off the charts. And I was an art therapist who knew graphic development, drawing recognizable figures like a person in a helicopter at the age of 2.5, or having perfect pitch and color recognition that somebody might call something pink. And he turned to that adult and say, no, it's magenta. So I started seeing the world through his lens, but the pediatrician never mentioned the G word. It was only when he was in his educational situation where they had government tests that he scored in the high 90s in his elementary school that the school handed us a pamphlet for CTY, the Center for Talented Youth, which is an enrichment program, as you guys probably know about. They also never mentioned the word gifted. So still, I felt like I was in the dark, like there were these differences. But we pursued the CTY testing and he tested into the program. But sadly, he didn't really conceive of himself that way. And he made very little use of the program. So I think that some of the work that your listeners are doing in their families or if they teach is really about identity formation and understanding how to access the full potentiality. Because for him, he was really clear, I don't want an additional program. He was a 2A kid, so he wasn't one who wanted to spend extra time doing something. He didn't have energy at the end of the day to add an extra enrichment program. He saw it as more of a burden. And I think that's something that we need to think about with our 2E kids and families. What are the limits of both the parents and the kids in terms of what choices we make? So we had to make big choices, like changes in the educational programming. We ended up sending him to technically it was considered homeschooling program. We pulled him from the private and the public system. And it was an innovation school founded by MIT grad who was experimenting with a new educational model. And that was amazing. It was project-based learning. And he ended up being in a room full of 2E kids where everybody's neurovariances were accepted. Yep. This is like the ideal situation that we would hope for. So there were no grades, there's no age or chronological grouping in any way. And this was really fantastic for him. So he got to really start to fly in art, science, engineering, and design. And that funneled him into the place that actually the G word was used for the first time and dumped me into learning much more. And that was that he went to a high school that was really strong in the arts. And teachers said to him, or said to us for the first time, of course, you know, he's gifted. You could insert the record screech here.
Yeah.
It was like, stop everything. What? And that was like the opening of everything. So like Scholastic Awards later that he got, and then my autodidactic deep dives into books and websites and meeting people at the right time. And I got involved in the gifted community through MAGE, the Mass Association of Gifted Education, and Barry Gelston through the Gifted Homeschool Forum, who I know you know.
Yeah, he's lovely.
And got more and more involved and became more involved in leadership in these institutions and a professional group. And then clinically, I had to start looking at my work, my clients, what was going on in my office. And that changed my whole lens. I had always been involved in Elaine Aron's work, which actually is now 50 years old, that she's been doing stuff around the highly sensitive person. And Judith Orloff's work around, she's a psychiatrist around intuition and energy processing. And that spurred me to see the connection with my clients. My main practice was women with ADD or ADD in general. These clients were smart, successful, sensory sensitive, and struggling. And a new term of misophonia 20 years ago came on board. And that really resonated with me, my family, my clients, really looking at it through a sense of strength. What strengths do people bring to the table? And that's how I did my work with my clients. So I found myself starting to wonder about them and looking at their charts. I went back and looked back at all the charts, the testing, the backgrounds, the education, the achievements. And I'm thrilled and also embarrassed to say that everybody missed the giftedness in these clients. And it wasn't just the people missing it because they weren't looking for it, but it's also the state of affairs in where we live and work, which is in Massachusetts, which is 48th out of 50 states, in using the language, the terminology, having people educated, teachers, clinicians, anyone. So that made me do a turnaround in my professional world as well. So working at it from like the personal to the professional, I looked beyond the numbers. Actually, only one chart had somebody identified as gifted. From all the neuropsychological testing that I was reviewing, nobody used that word ever in Massachusetts. This is a big issue in the state of Massachusetts that we're trying to rectify. But looking beyond that, I then found that about 98% of my clients were gifted. And that sounds like really skewed. But when you think about where my practice is located, this is in the bedroom communities for institutions like Harvard, MIT, Brandeis, Tufts University, all these schools, like all these people who are living here through generations. It's not as surprising that who's showing up at the door is going to be a different slice, at least in the intellectual realm. But I'm trying to focus less on the intellectual in my practice and more on the other spheres of giftedness, particularly the emotional and the social. So I've been turning my attention to the intersectionality of different realms of giftedness, like sensory processing, leadership, emotions, creativity, achievement, and spirituality. All of them are the realms that I incorporate into my perception of giftedness.
Wow, that's wonderful. I do love asking that question, and I can't off the top of my head think of anyone who has answered it on the podcast and hasn't had that lived experience impact their involvement and ongoing journey with giftedness, and which used to surprise me but shouldn't, because I guess we all get into it through our own personal experiences or that drive to continue in the area. What you say about the gifted label and how important it is to use that and recognize that. And anyone listening, I acknowledge that there is some complexity around labels. A lot of labels are needing a bit of a reframe. But certainly one thing I have learned is what the label gives you is a language, a narrative, an identity, knowledge, understanding, that potential to connect with other people who identify with that label, which is so important in terms of, like you said, with your son and his experience of actually finding an educational environment where he's around like-minded people and just having that opportunity to thrive. That sounds like an amazing opportunity.
Like an opening to a community.
That you didn't know you were part of. We're all
Absolutely.
willing to belong, and whatever you call it or don't call it or reject it even, you can find community in rejecting something. But if you don't even have a language to understand like this profile, this neurotype.
Absolutely. And I think even more so for the gifted community, because there is that inevitable degree of a deep thought and internalization of so much. So for us in particular, I think finding our people, understanding ourselves, it's inherent within us to want those things and go down that road. It's such a wonderful and rich journey. Thank you so much for sharing that with us. And we did end up there with misophonia, which is what we're going to dive into today. So tell us what it is and how is this relevant to our sort of gifted and TUI community?
Okay. What it is, most people who've heard of the term might associate with it or say that it's a sound processing disorder or a sensory processing condition of lowered tolerance with like emotional dysregulation to certain sounds that connects with emotional reactivity to certain emotions like disgust, anger, fight, flight, reactivity that ends up being a reaction to something that other people don't react that way to. So it seems really out of proportion to whatever the stimulus or the cue is. Those things are called triggers in the misophonia world. And surprisingly, they tend to be soft and quiet things if you're talking about the auditory realm. So repetitive sounds like somebody coughing, sniffing, throat clearing, pen clicking, usually repetitive sounds like foot tapping or foot moving, like families or school systems or classes where there's a child who freaks out at another student or a sibling chewing or even breathing or moving, or somebody who can't concentrate and gets really upset by that because they get irate at someone's clicking on a keyboard, which we know happens in a lot of realms. This about 20 years ago was coined misophonia by the Jastrobroffs. They were two audiologists. They called it selective sound sensitivity syndrome, and it was later changed to misophonia, meaning hatred of sound. But we now realize that all of that is not accurate, that although in the realm of misophonia, there is targeting something, so there's a selectivity to it, it can also generalize to other stimuli that can cause an emotional or intense reaction. But we're now realizing it's not just about the emotional reactivity. It crosses over, as we know in our gifted profiles, engages what one hears, sees, such as movements, touch, and involves the mirror neurons of the brain, which I can talk a little bit more afterwards. But the brain structures involved that are particular to empathy perception of what goes on in our bodies, like interoceptive attention, body emulation, and movement. So it involves experiences, thoughts, memories, learning, expectations, social context, and the meaning someone makes of the stimulus and their involvement in it. So we have a new way of thinking of misophonia, even though it's only been 20 years. And misophonia research is actually in its infancy right now compared to other conditions, we should say. Our better understanding now is, I would call it this. I'd say it's a neurophysiological, sensory, cognitive, psychosocial, emotional variant of wiring that results in lowered tolerance to certain sensory input that gets processed by the brain and by the body and emotions in a crossover, extreme way, sometimes resulting in an instantaneous or big emotions and behaviors, like we call them, like intense reactivity. Some even have called it an emotional synesthesia, where there's a crossing over of emotions and thoughts and feelings in all these different realms. I'm going to go into a little more detail, but what happens is that the sympathetic system gets activated at a particular trigger, or even anticipating that trigger. And the fight, flight, fawn mechanism gets activated. And so people want to get rid of the feelings that come up inside their body because they feel like they're in a torturous situation, or they want to avoid arriving in such a situation if they've learned from the past. So the realms of the visual, like the foot shaking, that can still be a misophonic trigger, or being repulsed by certain touches or textures, like even sandpaper and velvet, which the majority of people don't like sandpaper and do like velvet, but you may have the opposite reaction. Or hearing mechanical sounds like leaf blowers, or smelling strong smells like cheese. These are common misophonic triggers.
Okay, so in a summary there, it's a reaction to a variety of sensory stimulus. So it could be something you hear, taste, smell, touch as well. Touch in terms of sandpaper and velvet. So a whole sort of sensory system. And it's
Even
having a
beyond that.
reaction even beyond the sensory system.
Even beyond the senses, or what we consider as traditional senses.
So take me there.
Proprioception. I don't know what the sense would be if you perceive energy or vibration.
Oh, yeah, totally.
I don't know what you call that. A kinesthetic
like a
kind.
Perception of energy or vibration.
Right? Or even activity, which we think of it as sense, but not really sense, like being sensitive to certain lighting, or how light or dark something is, or flashes and things like that. That's sensory.
Okay, and then so it's having a emotional, physical, whole system kind of response to that stimulus, which is uncharacteristic. I'm thinking of numerous examples. I have a family member who really struggles with the sound of other people eating noisily, and another family member who eats very noisily and is a bit hard of hearing, so doesn't realize, so that's fun. And so big noises like leaf blowers, things like that, but also like persistent coughing. And I have to say, I've definitely experienced that, just that sound of someone in the house with that persistent cough, having a reaction that's, no, be empathetic, they're not well. Also, what came to mind as you were talking there is having a visual response. So there are some patterns that I see that actually make me feel ill and want to run away. And also, when you were saying like the energy thing, when my first child was born, we had them in the same room with us in the cot. But when they cried, it would hit me as a wave of energy rather than a sound. I would physically recoil from the impact of the sound, feeling the sound rather than hearing the sound. That were just some things that perhaps were some, I guess, real life examples to help people maybe think about what they might have in their own lives. Okay, and so the impact there then, so we've got these stimulus from all of our sensory systems. And the point is, I guess, that it's the response, isn't it? It's that kind of psychological, physical, integrated response.
I want to take you into a deeper sense of this, because you've tapped on some really important points. You mentioned the word empathy, and you described the kind of assault on you. And this is where we dovetail with the gifted community.
Yeah.
That I wanted to differentiate a little bit, because we know that many people in the gifted community are sensitive, either sensory or defensive in their sensory systems. We have a euphemism for giftedness, which is intensity, right?
Yeah. Yeah.
that goes along with it. And Dabrowski, when he talked about his like 5 areas of processing that we kind of use metaphorically as giftedness, he used the term sensory superstimulabilities
Yeah.
or overexcitabilities. We translated it to overexcitabilities, but in fact, it is superstimulabilities. It's being uber stimulated by certain things that hit us in a different way than the average person. I know there's an article on Grow Gifted by Duncan, Goodwin, and Haas that goes into a little bit of this. So the sensitivity in misophonia is slightly different, or in addition to, or unification of some of those superstimulabilities. In misophonia, if I use the example of, let's say, a fire engine or crying, there might be a sensory processing of our sensory mechanisms that is overwhelmed in some way because we might hear things louder or more sharply or at higher amplitude, and that's in the auditory realm, or feel it with touch or others in a way that involves the mechanism of that sensory system. So I might cover my ears if there's like a loud siren, or you might feel the impact, the intense impact of the crying, but it doesn't necessarily take, at least me, to the place of disgust and anger and being rageful. Although some people to crying, I was thinking of airplanes, people do reach that level. So context is really important too when one feels like trapped or that there's no way out. There's a certain realms that especially kids feel more trapped in. These sensitivities are a little bit different than the misophonic added layer or icing of the emotional realm and the behavioral of how they react to it. It's hard to describe, but we can also have phonophobias, which is a development of a fear. You can have a parent develop a fear of their kid crying because of the feeling that gets triggered within them. These are separate entities that kind of coexist. I'm doing my Venn diagram here. Separate entities that kind of coexist, can coexist with misophonia. But when we look at them and try to work with them, we have to consider them a little bit differently because they respond differently to different interventions. We don't want to get rid of misophonia or that sensitivity that someone has, because that could be the source of their strength, could be their identity, like having great empathy or a great sense of smell or visual acuity. You can become a perfumier or an athlete or an artist or something like that. So we don't want to take that away. But there's an instantaneous nature to misophonia and also a subtle nature to it. There's also a layer of attribution that is about intrusion that you just referenced. You didn't use the word assaulted. I used the word, but you mentioned something like it coming at you.
Yeah, an assault on the body, uncontrolled
on your beingness.
attack. Absolutely, yeah.
Yeah, it's partially like an intrusion if, let's say, you're sleeping and then all of a sudden, that it's like an assault on whatever was you were taken out or away from wherever you were. And that's a big component of misophonia. So we're building a model that has all these different elements that coexist. It's not just about how hearing functions or how touch functions or just having like extra uber sensitive touch. It's these multiple layers that are woven into it. And that includes one that's related to a part of the brain that we know is involved in misophonia, the insula, the AIC, the anterior insular cortex, that injustice is a layer of this. There's a resistance and a perception this shouldn't be this way, that I don't like it, I don't want it, I don't like that they're doing it, they shouldn't do this. There's a whole layer in this that is about wanting a situation or oneself, one's body, or the room, or the people, or the situation to be different than it is, because that intrusion takes people to places they don't want to go. Emotional places, physical places, thought places. So we know that our gifted community and those with misophonia actually do perceive and sense things and react to things more quickly, more intensely. We can measure this. And then there's another layer, which is the aftershocks afterwards, which is if they do behave in a way, even ask somebody something or run from something or hit somebody or do something about it in a way that they actually don't approve of in themselves, then there's a whole cascade, part of the cascade, I call it the misophonic cascade, that's about their own sense of self and feeling very self-conscious during and after, guilty, ashamed, not wanting this to happen and not knowing how to stop it from happening because there's such a neurophysiological part of this that they don't have conscious control over it. And there's also new learning. Our gifted people learn quickly, right? It's one-shot learning. All of a sudden, these people, that thing, that trigger, that place, these circumstances, they all become new learning to bring to the next experience that somebody then wants to avoid or doesn't want to be part of or doesn't know how to navigate assertively, how to make it different.
And I imagine that part of it, I can feel that in terms of then setting up the anxiety of the anticipation of that stimulus being experienced again. And you mentioned the word cascade, but definite, like that loop of the experience, anxiety, and the anticipation of a future experience. Yeah, cycling. And also in that process, so it's the intense reaction with the big uncomfortable feelings, but then also with that cascade, that sense of shame, embarrassment, guilt. Because like I said earlier, with my family member coughing, it was really affecting me. But then I also felt shame and guilty because I know that it's not like they could help it and they were feeling bad.
The metaphor I used when I think about, first of all, how fast they've actually measured how fast a misophonic reaction is. And the number that's out there right now is about 3/1000ths of a second.
Yeah, wow.
There's something going on in the body, brain, mind, in the experience of the person that's a shift. And that it's so intense or something is happening that feels like 1 minute you're in one situation and then you're hit by a taser or something that's just boom. That's what you were talking about. So there's a sense that the body can be hijacked or that one is removed from whatever one was in or doing, or especially if it's concentrating or something like that. And those triggers, so to speak, become a symbol of what one wants to avoid, that being hit by something that you're talking about, or even avoiding the fallout afterwards, because that might even be more disturbing to somebody than the actual stimulus or the circumstances. It's feeling out of control.
Out of control, yep. And so is it one of these or both? The experience where you're every time that stimulus happens, you have a response, and or more contextual, like resilience is low, the response to noise actually is intolerable, but not always noise. But in this circumstance, actually I can't tolerate it. So is it both of those things, the always or the within context, or just one of those things?
I'm careful to use the word always, because on the one hand, people will identify that a particular trigger often will have them react. On the other hand, we know that the context is really important, and the social situation of the sense of safety in that moment is also important, because somebody might be then in another situation where that same trigger is there and they don't react at all. And this is what's very confusing for people to understand, that it isn't consistent and it is responsive to how stressed out we are, what is how safe somebody feels. Because there's a whole piece of this fight flight reaction that is part of it that has to do with neuroception, which is a polyvagal term about our bodies and our brains are constantly evaluating how safe we are in a given moment. And when we feel really relaxed and safe, we're not likely going to be as reactive to this. When we're healthy, or we've had good sleep, or we're eating well, or we're with people who we can trust. I had somebody just the other day say they were in a group situation where the guidelines of the meeting, of the being together, was unconditional positive regard. There was a tolerance and an appreciation for whoever anybody was at any given moment. And they didn't have their misophonic triggers activated during that kind of a group situation, whereas in a different context, they would. So when you talk about families at the dinner table, this is what comes up a lot. And I actually have some case examples of people I've worked with, if you wanted some of those.
I would love, that would be amazing. Help people identify.
Okay, so I want to tune into some of the body changes that happen that we know and are measurable. So things like, we know research says pressure in the chest, increased blood pressure, heart rates change, body temperature changes, sweating. Sounds like a panic attack, but it isn't. It's part of more of the fight flight mechanism, but also part of the mirror neuron mimicking that goes on. And we can talk about that.
Yeah, I want to talk about the mirror neuron. But feel free to come back to that after the examples. Yeah.
Okay. I'm thinking of a 12-year-old who was seated next to another child in a classroom who was sniffing incessantly. They felt intense irritation in their own body. They worried that they might hit that other kid. There's a perception and there's an observation of oneself. They felt trapped, angry, and ashamed, she felt, of herself, and was like turning red, even thinking about it, with the level of guilt she felt for having those feelings. And asked the teacher to move seats or to have the kid removed, which of course didn't happen.
Yeah.
And she would often then self-isolate at school, like at lunch times or other times, because she was not only afraid of what she would hear that she didn't want, but also protecting others from her.
Yeah. Oh,
So
that
that's
sounds
one example.
very hard. Yeah.
Hard. These are people
Yeah.
who are very hard on themselves. These are
Yeah. Yeah.
type A, very self-conscious, want to do right in the world, very motivated by doing the right thing. And so that's why misophonia has so much of an ethical angle to it, that there's an ethical violation of the other, but an ethical violation of oneself.
Yeah.
So a high schooler hates whispers or soft touch or muffled sounds from the room next door. Now, this is where some auditory processing stuff comes in, and tells the parent that they can't stand the S and P sound that the teacher makes because it hijacks her away from her work. And she imagines hitting the teacher.
Wow. Yep.
Which is scary.
Yeah.
She fidgets, doodles, and is bored in class, but she just tolerates it, grins and bears it, and then falls apart, of course, when she goes home.
Yep.
Another one around the dinner table is more cultural element, where depending on the culture you're in, the behaviors that you find egregious vary. A particular person was American-born teen who endured meals with distress. When her grandmother came, she felt a sense of disgust and anger because her grandmother chewed with her mouth open, slurped, and smacked her lips, which actually was customary in the culture of origin. But she didn't want to be perceived as rude and unloving, and she surreptitiously self-injured to reduce her distress. And just one more case is more of the tactile nature, which is a 10-year-old angrily hits the mother's hand when the mother's fingers touch the paper, like any paper. These are not things we normally consider to be reactive, but she jumps up and runs away from the mother and the paper, but is later able to articulate what I call this cascade. She says she saw the finger touch the paper, heard the annoying scratching sound, sensed a most disgusting feeling that ran from her stomach to her arms to her throat, causing her to feel nauseous. And she was embarrassed by this and ashamed and surprised at her own behavior at such a stimulus. And she asked in the family that no one ever touch paper again.
You describe the cascade, the process, but when you hear those examples, you get this huge sense of the impact it's having on those individuals, even to the point of self-harming, to manage those emotions, the shame, the guilt. It's just a massive impact, isn't it, on those individuals experiencing this?
Yes, it can affect families. It can affect, obviously, mental health, but families, work settings, social situations, just being able to relax and be around people, especially in the home. We saw a huge uptick in misophonia and an awareness of it during COVID when people were in lockdown.
Yeah.
And so they were with each other more often. There was greater tension in those households. And they also were exposed to each other for 3 meals a day and snacks or whatever it was. And so tension that was just building in general, where there might be conflicts or might even be developmental things going on around adolescents with their parents. Then misophonia might be a place where it gets further acted out or further expressed, actually, to that tension is being targeted to a particular behavior. And then when that's reduced, that where we can intervene on it, or if we understand what's going on, then we can make a big change in it. But you wanted me to talk about the mechanism of misophonia, sort of the mirror neurons and stuff?
Yeah, I'm very curious about that, if you don't mind.
I want to use an example that will actually set the stage. The most recent studies are looking at the mirror neurons as a big component of what misophonia, I don't want to call it reactivity or responsivity is. It's the experience of it. If you imagine, going back to the baby example that you used before, the crying, if we hold a baby very early on and you stick out your tongue, the baby will stick out its tongue. They're not thinking about it. They're not saying, oh, I'm going to emulate what you're doing. They just do it. Or if someone's yawning, you might yawn similarly. So there's something that's a non-conscious process that's going on that looks like it's active in misophonia as well. So we have a lot of people who will complain of reacting to throat clearing or guttural sounds, or even the movement of a leg or a finger or something. And what we're understanding, at least from that one study, is that there might be micro movements that are going on where somebody's body is emulating the person making the other, whatever the expression is. So if they're throat clearing, some misophonics will throat clear. Some may not throat clear, but they have some sensation and feeling in their body that feels foreign to themselves. This is another way of being hijacked. It's through the empathic network that goes on in the body and the brain that relates us to others that we don't consciously understand or have a way of intervening initially, that people feel that their body has been misappropriated in some way, or that there's some urge or nudge. And actually, for some people, if they feel something, if somebody throat clears, they may throat clear themselves as an antidote to the feeling inside their own body or the discomfort that they feel. So the discomfort isn't really about pain and suffering. The discomfort is about being a foreign experience that we can't make sense of.
So you going back to that idea of the intrusion. So we're mirroring in some way, but that's feeling intrusive because it's this unconscious response and it feels uncomfortable, and that's causing the distress.
So there's this whole realm that's out of conscious awareness that is driving both the experience and the perception and the discomfort and the reaction to the discomfort. That is why people who have a misophonic reaction feel so out of control, because it actually is in some ways not within their conscious awareness and control.
Yeah. Wow. That
so
is so
they don't
interesting.
understand.
Yeah.
So they can't explain it. Like somebody might say, why did you do that? And they have no idea why they did it. There was no why involved.
It's such a great conversation to have to really unpack this, because for anyone who is resonating with these experiences, especially as parents trying to parent our children, it's knowing that it's out of control and there is actually a known process, an understood process here for those individuals or kids who haven't managed to rein in the response. Like you've mentioned, a lot of people feeling like they want to hit someone or something. And for all those examples that listeners might have of where the individual hasn't been able to rein that in and has actually reacted in that way, just knowing that it's not deliberate, it's not being naughty, it's just this very uncontrollable response to something that is also out of their control.
So that's where there's this fusion. It's interesting, where empathy is a big part of what causes misophonia, but empathy is also a big solution to what's going on in misophonia. So I don't know if that's want me to say any more about that, but we have a lot of people. Go ahead.
Oh, no. So I was just going to say empathy being a big part of it in terms of our empathetic response to the mirroring. Is that how you mean? Yeah. And then obviously in the management of it, just being empathetic to those people experiencing it.
Right.
Yeah, absolutely.
Compassion for their experience, as opposed to what you said, which I agree, the sense that it can be misattributed to being naughty or being motivated by something more sinister, or just trying to get attention, or being a bad kid. None of this is what's going on. And that's what's hard for people who are misophonic, who are generally, as I said before, like rule following, wanting to do right, very self-conscious, sensitive, as we know, people. To have those attributions is yet another assault on their sense of self, and yet they don't have an answer to explain what's going on or even how to change it.
And I'm also interpreting this, and tell me if I'm right here, in terms of separate again to a meltdown response to the overstimulation of sensory stimulus. So someone who's just overwhelmed with all sorts of various sensory stuff going on and then having a meltdown is separate to this, because this process is about that, the after effects, the guilt, the shame, that kind of, and the fear of that happening again. Whereas like a meltdown from that sort of sensory overwhelm is, I don't know, there is and can be a lot of shame after a meltdown from that as well. So are they different?
Well, I think you're nailing something that I think we need more research about, because there's so much coexistence of misophonia with other, what we would call diagnosable conditions or clinical presentations. So commonly we would think like probably about 10 or 12% of people overlap with AD, because if you get hijacked from what you're doing, you might get really upset and you might have auditory filtering issues going on with ADD. With autism, we know about that not overreactivity, the overwhelm that comes from sensory overload that kind of like shuts down the system. That looks like it's a separate entity, and that there's a big debate now, and research money's pouring into research about, are these all separate conditions? Do they converge? Are there overlaps in some way? And we are looking at that. I think the overlap with autism is probably around the same thing, about 10 or 12%, but that's relatively common when you can have like triads of things, right? You can have ADD and autism. And so we have our discerning mind that wants to know, is it a this or a this? But what is important is being able to understand all of these different things and get the flavor of what this one is that you're dealing with in front of you. So then you can bring in interventions that can be helpful. So in the moment of an autistic meltdown, someone's not able to think through new thoughts and how they're going to textualize it. Or in misophonia, the learning might come after an experience or a new experience, but not necessarily in the moment either. So I don't know that it's so easy. I think you've hit the nail on something that is a convergence that we're trying to understand better. We know a lot of OCD or OCPD, obsessive compulsive disorder or obsessive compulsive personality disorder, can coexist at a very high rate with misophonia, of liking things to be a certain way. It also can be that way with autism too, of the situation was just too funky flexible or too much for what my system can deal with. But what we are acknowledging is we're in the neuropsychological realm. These are neurophysiological and other like psychosocial, behavioral kinds of conditions. And it's not about will, and it's not about just behavior. So you're on target. I think you've met me in this conversation where the research is and where we need to take it to figure that out.
Yeah, it's so interesting. And so I want to ask next then, you mentioned interventions. For anyone listening who's, oh my goodness, what kind of things can someone do? What does that look like?
I have a whole bunch of things that someone could do.
Oh,
so
excellent.
The good news is understanding it enough that we can now offer, there isn't one intervention. There's been a lot of research. I shouldn't say that. I should rephrase that. There's been a degree of research that is now identifying certain interventions or certain mechanisms that are going on. But we happen to be at a zeitgeist right now where there's a huge amount, like millions and millions of dollars being thrown into more research. So it's very exciting time. But we know that this is real, and that is one major intervention. Right before, we didn't even know what this was, and people could misdiagnose or misunderstand what this was. We tend to direct ourselves towards coping rather than getting rid of this, because we can't get rid of different wiring. We can try to change wiring. We can intervene with support. And if anybody Googles, they're going to get like over 3 million websites associated with, or hits associated with misophonia. So it's not like there's few people saying anything about this. It's not rare, just so you know, statistically. You can tell old research about what it is and what to do when it says, this is a rare condition. Oh, it's not true anymore. And the new research will say, this is a pretty common condition, which is about between 13 and 20% of people have mild, moderate, or severe misophonia, where only about 6% is in the severe range. And if there's a common condition like we we're just talking about, that raises it to about 50 to 85%. There's misophonia coexisting with other conditions. The first intervention is to create a safe environment. What does that mean? That might mean physically safe, emotionally safe, auditorily, visually, tactily, whatever the mechanisms are involved. And that is one of the greatest interventions that can be, because if we look at the fight-flight mechanism and see what activates it, then we need to recalibrate the system in order to regain a sense of control of our body, our breathing, our heart rate, or whatever. So being able to retreat to a place or to create a safe haven, to then remove oneself from what is the activation, or we can even use the word meltdown, internal meltdown or external meltdown, and then be able to, when ready, come back into a situation. This kind of reflects, there's somebody who has a program called Regulate, Reason, Reassure. This is Jennifer Jo Brout, has a book that's like a pamphlet that parents can read, or even adults. I think she has 2 versions of it, that really is about regulation interventions and respecting the needs in the moment. I'll mention in a moment, that's the opposite of the concept of the tough it out, grin and bear it response, which some people mistakenly think is an intervention. I'll mention that in a second. But the things to do are about invoking more choice, where someone sits, what they look at, what they're listening to, creating that safety, practicing changes in one's thoughts to have certain phrases, certain mantras, teaching self-compassion skills and positive self-talk skills. So there's a lot of skill building and practicing that it goes on so that you then use it in a moment. Assertiveness skills. How do you actually say to somebody, or can you say to somebody, by the way, I have a sound processing condition. Would you mind not crunching those pretzels? Most people don't have access to that.
Yeah.
Good sleep hygiene. Yeah, that's one of the hardest things is they don't ask somebody what was the worst case scenario, what is the worst fantasy of what they would do if they acted on their misophonic experiences inside. And they said they would ask somebody not to do what they're doing. Now, that's not the whole picture. There are people who have much more all the way like aggressive kinds of responses, but that's pretty rare in the field.
Yeah.
We have, if it's auditory, we have barrier methods that can be used. There is everything from earplugs to noise canceling headphones to sound generators. If somebody sees an audiologist, they can create sound that actually changes the gap between the baseline sound and the intrusion of the trigger sounds. The caution is that wearing earplugs a lot or noise canceling headphones a lot actually can exacerbate sensitivities because, as we know, when you take them off, the world is like really loud. So it's not something to use all the time, but it's something to use intermittently or certain situations. So at the dinner table with that particular person, it can be a useful thing. Sound maskers, like I mentioned, the sound generators or different machines in the room, creating brown, pink, green, or white noise, these different things. Practicing relaxation techniques and breathing techniques and mindfulness things and progressive muscle relaxation to get before the meal or during the meal or after the meal, getting some of that physical tension out. And then having an ally in the room can be very helpful. So if there's somebody you can roll eyes with, or you can sit near who, or in some way, that can be very helpful. Or somebody having a warning about something. I'm gonna be running my finger on this paper. So do what you need to do to take care of yourself. It's not the unpredictable intrusion that holds more power than something that's a little bit more predictable. Although predictable, like the clock ticking, can also be a trigger for some people. We want to lower vigilance and raise resilience. So how do we do that? Some of these intervention techniques about safety in body, mind, and emotions actually increase safety. And that, by and large, affects the sense of vigilance that happens. Because we're not as vigilant when we're in a safe situation. But we can make environmental tweaks, like what's in the environment, what isn't in the environment. And I'm aware that people can see that's kowtowing to somebody who has misophonia. But we need to find what is that sweet spot of collaboration and empathy and compassion and supporting the person to be able to self-regulate in a way. So if somebody says, I can't be near that right now, if that's an automatic statement, that's different than if they're really like at that moment emotionally tapped and they're assessing that they can't be with that particular stimulus because they know what's going to happen to them. So we want to discern some of these subtleties. Encouragement or safety, like planning out, can be very helpful rather than having rules like, if grandma's coming, you have to sit at the table, even though you can't stand how she chews. But it might be, how about you sit over there, like in the kitchen area, and you can still hear us. And then as you feel comfortable, you can grade it in a gradient way, bring yourself closer or come back and forth. So there's a certain flexibility in parenting that's involved in this that can make a huge difference with it. There are fields that help, like audiologists can help decide and determine if there's actually an auditory issue going on with the hearing that is more sensitive, or an auditory processing evaluation. Is there really potentially a gating deficit going on in the way the brain and the ears and the hearing mechanism communicate with each other, or a sound discrimination issue or something like that? Occupational therapists have a lot to offer in terms of exposure to different sensory input and stimuli and changing the situation. Neuropsychologists can help figure out a lot of this fear of like, where are the strengths and where are the challenges? And psychologists can be very helpful in helping people to kind of balance what are the different coexisting conditions that are going on. But I would recommend working with a clinician who's familiar with misophonia for this reason. Many of them mistakenly think that misophonia is an anxiety disorder, or at worst, psychosis, or confused with autism spectrum, and then will offer interventions that are in keeping with the error as opposed to misophonia. Yeah. So what I was saying before about exposure, the idea of Green and Barrett, if our people sitting at the dinner table, if exposure worked, they wouldn't be consuming more because it's a repetitive thing that they are perpetually exposed to. It doesn't work. But the research, we understand why one would think it would work, because there's an assumption that you will habituate to it if you're exposed to it a lot enough that you'll eventually extinguish your response by the system learning that it's not really a threat and eventually get used to it. But that actually doesn't happen with misophonia. The research shows that people get sensitized to the trigger. They learn about it. They will be able to predict it sooner and faster and more intensely, and they will react more intensely. And that's not the way to go. Exposure to triggers, like the classic is the therapist who says, you don't like crunching, so bring in chips, and then sits there crunching the chips with the person sitting there. That is the most torturous kind of intervention that actually is going to backfire. So there is exposure to one's inner experiences of one's body and reclaiming one's body through mindfulness techniques and through counter exercises. If you're feeling tight in your chest, doing something to expand your chest and being able to take control of your body and your brain, those kinds of things work. Learning flexibility and self-compassion. How do you talk to yourself after you've been in a situation? Can you give to yourself? I had a client who said there's a part of her that doesn't believe that anyone should ever have to accommodate any of her needs.
That's very sad.
How do you then make sense of having needs if you can't meet those needs or even feel you deserve to have those needs met? It's a tough conundrum. So exposure with response prevention is not the way to go, but there are some cognitive behavioral therapy techniques or dialectical behavioral therapy or acceptance and commitment therapy techniques that clinicians can incorporate into a protocol for people with misophonia. I'm trying to think if there's any others that I wanted to mention. Looking at what I called misophonia being like the social empathy, like all the thought, cognitive, all these different realms, I intervene with my clients in every one of these realms. So we map out their misophonia. They target what are the ones that are the most disturbing for them. Like there is some stuff out there, like with counter conditioning misophonia that Tom Dozier does with an app. And it works for some people where they can identify a particular body-based experience, but not everybody can identify a body-based experience with their misophonia. So I've been working on this model that's a little bit more comprehensive and offers a lot of agency and choice for my clients as to what realms we're targeting and making sure we check back on those realms as opposed to having one intervention, which research is really working hard to find.
It's so fascinating. And so when you mentioned there, sometimes people can't identify the physical response. Is that due to just that interoception challenge potentially? It's not quite registering in terms of their own interoception.
So someone might be much more cerebral. So they feel that the violation that they're reacting to is that person's social violation. There's a rule, you shouldn't do it. You're doing it. You should get punished for doing it, but they have no idea that the core of what's happening might be going on in their body.
Yeah.
Attunement to one's body. Some people will do that work. Most people will not want to spend the amount of time to reconnect with their body, but we could do subtle interventions of how to relax the body or how to relax some of the expectations of others or even oneself in the situation. So trying to tune into what they see as the mechanism, but not everybody comes in being highly attuned to what's going on in their body or even their emotions. Definitely. We know people don't know how to even label their emotions.
Yeah.
So it's just.
Yeah, just exactly. There's a thing. That's so fascinating. Thank you so much. And it's good to know, like, there are many things we can do, different professionals, different ways of approaching it. But as you said, that key to really understanding what misophonia is obviously paramount. So you're not getting misdiagnosed or misunderstood, and you're getting the correct kind of approach and interventions. And so the interventions are very much about what we can control and how we can feel safe, and focusing on that rather than, like you say, exposure to more of it, because that just increases the sensitivity, which is
you should. And the world is going to be a tough place. You have to get used to it. You're always going to be around people who are eating, or you're always going to be around people who touch you in ways, or like all these different things. But yes, it's really about the tolerance and the right now, and learning the skill set to apply to those situations in the future.
Yeah. Wow. Thank you so much. That was just so much amazing information, and just a really great understanding of what it is, what it looks like, different things we can do about it, about something that, certainly hadn't been quantified for me. Yeah. Thank you so much for sharing all of that with us. As we wrap up, could you share with us, who do you work with? How can people find you? Are you explicitly in person, or do you work online with folk? Tell us a little bit about that.
I have an office, which you can actually see in the background here. That is my office, but I have not returned to it yet. So I'm working pretty much exclusively right now online, which means that people can reach me from anywhere, so long as we can match the time zones. And they can reach me through my website, which is drheidilack.com, or my email, hl@drheidilack.com. I have an arm of my business that is consulting and coaching that I call Exceptionally Wired. And that's the piece that I can't be a psychologist working outside the state of Massachusetts, but I can consult to people if they have other supportive people in their lives, like a physician or someone else going on in their life that can hold the local aspect of their work. I work with adults mainly, but parents, families. I've been seeing, since COVID, I've opened my practice to seeing many more, or consulting with many more families, where I'll meet with the parents to get a sense of what's going on. For mainly older adolescents, if it's really somebody like in tween years, which is when we see misophonia come out or manifest, those people, first of all, Zoom isn't a great format for them. And second, they want quick fixes to things. They may not understand all aspects of it. So for the parents to be able to intervene in their family, that tends to be a good model, where I might meet with the child or the teen separately on Zoom after I've met with the parents, or meet with the parents, depending on what they want. But mainly I meet with adults, families, elders, a lot of college students, because that comes up around dorm rooms and accommodations. We didn't even talk about accommodations that can be made in schools and in colleges and in work settings for people with misophonia when it's classified as a disability. I try to help people make the changes and how to get the accommodations and understand what's going on for them, to make the changes in their life and to inform the people in their life about what's going on. So that's who I see and how I see them.
That sounds amazing. Thank you so much. I will definitely share those links in the show notes for the podcast. And I feel like we could talk all day about all sorts of things. So I hugely appreciate your time today. That was such a fascinating conversation. Thank you.
Thanks for having me. I really appreciate being able to raise awareness about this for many more people. And I'm so glad that you have this site for families who need to be able to have the information to parent their gifted kids and be able to make things as best as they can be for everyone. So thank you for generosity of having me.
It was my absolute pleasure. And like you say, I do feel like there's probably a lot of listeners with our demographic who are going to resonate with this. Yeah, so I'm thrilled that you could make it and share everything. So thank you very much. That's
You're
great.
very welcome.
If you enjoyed this episode and it inspired you in some way, I'd love to hear about your biggest takeaway in the comments. For more episodes, you can subscribe, and to help others find our podcast, please leave a review. You can find show notes and more resources at ourgiftedkids.com, and connect with us on Facebook and Instagram. See you in the same place next week.